Hello everyone. First of all, I wanted to apologize for the delay in the results since the weekend. It's just simply due to the sheer numbers of the results and the need for us to collate them all and to make sure that we're not presenting any duplicate results. I'm sure you can understand that when somebody comes for an initial test, that's fairly straightforward. We can count that as a positive. But when they come for repeat checks, they will still appear in the list of positives, and it takes quite a bit of time to go through and check that we're only reporting one person for a single occasion at that time. So as we know that on Friday, the total number of positive cases that we've had since March last year were 1,804. On Monday, the 1st of November, that total has risen to 2,241. This represents 418 new community cases, but this is over a 3-day period, and that represents an average of around 139 people a day. There are also 19 people who were tested positive when they had their test to exit quarantine, and they obviously remain in isolation. These positives are on a background of having done 3,693 PCR tests since Friday until Monday. And just to give you some idea of the magnitude of these PCR tests, since the 8th of September, with our first community outbreak this year, we've done 44,248 tests in all. There are now 1,205 active cases overall throughout all of the islands, and in addition to this, there are 70 active cases in the sister islands. I'm very happy to report that of these, 44 are symptomatic and being managed at home, and 26 are asymptomatic. Of those 70 cases, 68 of them are on Cayman Brac and 2 are on Little Cayman. There were no vaccination clinics on Monday, so I can report the vaccinations as of the end of last week on Saturday, and this is a total of 115,481. For those people having first doses, this has now reached 80% of our estimated population of 71,106, and the number of people, absolute number of people, is 56,661. For those who've had completed the 2-dose course, this is 54,468 people, which is now 77% of our estimated population, and 4,352 people have had a third or booster dose, and this represents 23% of those over the age of 50. As far as admissions are concerned, we have had a few admissions since last week, and there are now 8 people in total admitted at the Georgetown Hospital, but I am pleased to report that only one of these needs supplemental oxygen. That means having a little bit of extra oxygen other than room air. So that is good news. Additionally, I need to say that on the whole, at the Georgetown Hospital, we often admit people and give them the benefit of the doubt in order to make sure that we can watch them and monitor them. And I think perhaps in even up to half of the cases that are currently admitted, in many countries these people may well have been managed at home, but we have erred on the side of caution to keep them safe and comfortable and under observation in the hospital. Thank you.